Representative Hodes, a Democrat from New Hampshire. Representative, going into the town hall meeting, one of the president's big issues, even if you sort of get through a lot of the things that are being talked about in this town hall meeting about choice and portability and all this, is cost. And while Linda Douglas and others will say, this is cost cutting, this will be deficit neutral, the Congressional Budget Office, as you surely know, continues to say that's simply not the case, which is why, again, people point back to Wyden Bennett or other more competitive type of structures as opposed to government-run structures which raise the ire of the live free or die crowd. How do you address cost?
Well, look, right now, health care is costing this country 17% of
There's so many problems with this Obama government. When I was elected
so
to
the
public
investment
office,
that we're making in health care is absolutely critical in order to prevent us from dealing with unsustainable costs in the future.
Right, I understand that, but the congressional, but here's the problem, Representative, is the Congressional Budget Office doesn't look at this as an investment. They look at it as an expanded expense. But let's come back for the cost conversation another time. Let's stay real present tense. The emotion around this in the town hall, self-evident for all of us who have the benefit of being able to watch the cameras that are in this room. The president will entertain his own town hall less than 3 hours from now, 1 o'clock Eastern time. How will the emotion be in that room? How do you think the president will deal with it? Do you think it will be a version of what we're seeing with Arlen Specter? Will it be more heated, less heated?
Well, look, you know, in New Hampshire, we are used to a vigorous public debate about the issues. You only have to visit us every 4 years during the presidential primaries to know that we're used to politics and we're used to expressing our opinion. I expect there to be an adult dialogue. I think we're going to be able to disagree without being disagreeable in the town hall. If we do disagree, the president is very good at dealing with questions and speaking clearly. And look, this is a very important issue. Nothing is more important than our health. And we are dealing with reforming a broken system to lower costs, deliver better quality, more choice, and putting people back in control of their health care. And any time you try to make a big change, there's going to be some resistance. That's what we're seeing. But I expect to have a very productive dialogue today that the country will benefit from, because we need an adult national dialogue, and we're finally having one about this important issue.
I totally agree. I guess where we run into trouble is both on choice and cost. Those who look at the current public option proposal and the Congressional Budget Office mathematics say it doesn't save costs, it adds costs. There are other proposals that are more competitive, like reference Wyden Bennett, not because I'm on the Wyden Bennett staff, quite honestly, but because I feel like our choices right now are no choice whatsoever, do nothing, which is disastrous, as you can surely talk us through. I can as well. Do everything in some public option, or Wyden Bennett. I'm sure there's 3 or 4 other options. How do we create a different conversation, not one that is do nothing, in other words, fly the airplane into the side of the mountain and don't change course, that would be stupid, or do some sort of government-run plan which gets everybody afraid that we're going to become England, and no one is saying that that's what they want to do. And how do you get people to focus on portability and cost savings, which is what you're trying to say you're doing?
Well, look, first of all, what you're seeing is the hurly-burly of democracy, and the president, I think, has very wisely shown real leadership in terms of his principles, and then he's leaving it to Congress, both houses, to work out the details, which he will then deal with. So we've got a House plan, we've got a Wyden Bennett plan, we've got other plans coming from the Senate, and we don't know what the final contours look like. But 2 important points. First, any health care reform that we're talking about will deliver more choice to the American people. It's as simple as that. There will be an exchange. People will be able to choose to keep their insurance with lower costs, or choose a public option, or enter the co-op to find a different private insurance choice. So there's more choice and more control coming to the American people. And you've got to look at this not just as a cost, but as an investment. So while we take costs out of the system, with fraud, waste, and abuse being cut by $500 billion, we are making an investment in the future of this country that our grandchildren will thank us for, because we're saving them from unsustainable soaring costs in the future. future. Those investments are going to be paid for. They're going to be deficit neutral. And with all due respect to the CBO, they're not always right.
Markets tend to, I understood. We'll come back for that. The biggest problem it seems that everybody faces in the healthcare debate is trying to prevent the raw emotion and fear from derailing the conversation to the point that it is no longer constructive, that the dialogue that you and I are able to have or others are able to have around choice, around cost, around tort reform, around all the things that are very important to discuss get lost in the cacophony of fear. How do you prevent that?
Well, look, we're in a very different kind of world. We're in a world where the Internet is powerful. There are lots of folks on news with a news cycle that's a 24/7 news cycle. The discussion that you and I are having now is the kind of discussion that we need to have, and so I'm grateful to be on to be able to talk about lower costs, better care, and more control for the American people, because those are the messages that are built into this bill. And when the American people understand, when I talk to folks who I represent, they say things like, I don't want the government getting between me and my Medicare. When I talk them through and point out that the administrative costs in Medicare are very low and that it actually is the government that's paying for their private doctors in Medicare, they begin to understand. So I believe that reasonable dialogue, that real information instead of misinformation is going to win out here, and I'm very confident in the wisdom of the American people. And while there's a lot of emotion, and there should be because we're talking about a big change, this is all going to work out fine in the end. The president is a powerful and compelling speaker, and I think in the town hall today you'll see him clearly addressing the concerns about costs, because he's going to address the fact that for people who have insurance now, their costs are unsustainable. This plan is going to lower their costs. It's going to lower costs for everybody and deliver better care.